Thanks for staying with us, guys. It's Thursday, and Dr. Azab is joining us to talk all things about headaches and what he can do to help.
One of the most common symptoms that we treat is headaches. Headaches can be caused by subluxations or decreased joint mobility in the neck, which can irritate the nerves, some of which go up into the head and can cause headaches. They can also cause muscle spasm. The decreased joint mobility can cause muscle spasm in the neck, and the muscles in the neck can cause referred pain into the head. Sometimes even behind the eyes, depending on the muscle. The trapezius muscle can sometimes send pain right behind the eye. So can the sternocleidomastoid muscle, which is the muscle that turns the head. Those can sometimes be commonly confused with refractive headaches, which are headaches due to somebody straining their eyes because their eyesight is poor. One of the things that people do when they can't focus, especially when they're using a computer, is they lean in like that to see the computer text on the screen. And when they do that, that can irritate and cause excessive contraction in the muscles in the neck. And doing that for more than a period of just even 15 minutes can cause spasm in those muscles and can cause an onset of headaches. Sometimes the prescription of corrective eyewear is enough to get the patient back into a normal position so that they don't strain the muscles in the neck. But sometimes that corrective eyewear, despite correcting the refractive problem or the visual problem, the problem in the neck is already, set in and needs to be corrected by a chiropractor. So we check for the problems in the neck to make sure that that's not contributing to the headaches. Sometimes patients are prescribed corrective eyewear, including bifocals. It's really important to make sure that the bifocals are used correctly. If the patient has bifocals and they're depending on the bottom part to read the text on the computer screen, then what sometimes people will do is this. When they're reading the text, they'll tilt their head backwards to use the lower part so they can read their computer screen. This arching of the neck to read through the bottom part of the glasses can cause neck strain and decreased joint mobility in the neck and muscle spasm in the neck, resulting in headaches. So it's important to use your bifocals correctly. If you're relying on the bifocal, the bottom part, to read the computer screen, it's preferable to not use them for that, but to get corrective lenses so that it allows you to look at the computer screen through the main part of, or the top part of the lens, so you're not bending your head backwards like that, resulting in neck problems. So one has to ask the question, when I'm using my computer, what part of the glasses am I looking through? If it's the top part and you're looking straight ahead and you're not having to bend your neck backwards, then that's appropriate. If you're having to bend your head backwards to look through the bottom part of the glasses, or the reading part of the glasses, then it might be better to get or ask your optician for computer glasses, one with the reading prescription all throughout the entire lens, so you can look straight at the computer and not strain your neck by repeatedly tilting it backwards. It doesn't take much time for the neck to get strained like that. More than 15 minutes is all it takes for the neck to develop problems with inappropriate computer use, tipping your head backwards like that. If one is having neck pain or headaches, and sometimes those repetitive bending backwards motions or repetitive extension motions can also cause irritation to the nerves going down the arms, causing numbness, tingling, or pain going down the arms. That would be an appropriate time to see a chiropractor, and at our office we'd be able to evaluate and differentiate what is being caused by refractive headaches or just eye strain and or problems in the neck.
Remember, if you have any questions, reach out to All Family Chiropractics and he can help you out. Don't go anywhere, guys. We'll be right back after the break.